song of deliverance from my enemies, till all my fears are gone. I'm no longer a slave to fear, no. Oh, I am a child of God. I'm no longer a slave to fear. I am a child of God.
From my mother's womb, you have chosen me. Love has called my name. I've been born again to a family. The blood flows through my veins. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. No, I am a child of God.
You unravel me with a melody. You surround me with a song of deliverance from my enemies, till all my fears are gone. I'm no longer a slave to fear, no. Oh, I am a child of God. I'm no longer a slave to fear. I am a child of God.
From my mother's womb, you have chosen me. Love has called my name. I've been born again to a family. The blood flows through my veins. I'm no longer a slave to fear. I am a child of God.
a song.
Amazon. It's on several other places. You can check it out, and we want you to do that. Give them some support. Very, very nice ladies, and we thank them for just being friends of Bethel. I want to say hello to some people in the room. Hello to Kenneth Yisrael. How you doing? How you doing, Brother Mark P? Sister Queen Cleo, how you doing? Brother Tobiah Vickers, how you doing? Sister NP, Kenja Stewart, how are you? D. Carlos, how you doing? Brother Abraham, how you doing, my brother? And this is Ronnie Yah. How you doing, Ronnie Yah? And Sister KT. Many others are there in the chat. We want to say hello to all of you all. And we have a lot going on around the world. I mean, it's just so much going on. It is, I don't even know what to say about it, really, and what's going on around the world. Hello to Tracy Haynes coming inside the chat room. Yes, I want to say happy Feast of Unleavened Bread to all of you. Happy Feast of Unleavened Bread. Hello to Sister Linda Viggers. How you doing there? I want to say that her niece is doing a whole heck of a lot better. Praises and thank all of you all for praying for her. And, this is what we have to do with this coronavirus. We just we're going to have to pray for people. Pray as much as we are able to pray because it means a lot. It goes a long way, the fact that we can just pray for people. All right, I want to get started on this. I know that you all can hear me. I have not gotten anybody to say we can't hear you, but if you don't mind, just everybody, let's just put a thumbs up in the chat room. It builds up our algorithm. Give us a thumbs up and or like in the chat room. We're going to get started. Now, I titled this probably something that, listen, I'm not one that likes to talk about the coronavirus and conspiracy theories and all like that. But there's just really so much going on with this that I thought it would be good if I just address the issue. And let's talk about it. I called it Corona, facts or fiction. Beware, just simply beware. That's what I'm talking about tonight. Fact or fiction, just beware. That's all that I'm saying. Thank all of you all for those thumbs up. Let me know that you can hear me. So let's get started. Ronnie Wealth, how you doing there, my brother? Glad to see you come inside the chat room. Good evening to you as well, my brother, all the way up in New York, I believe. All of you all. So let's get started on this lesson. It's not really a lesson. We're going to have a discussion tonight. We're just going to have a discussion. We're going to talk tomorrow. Tomorrow we're going to have a lesson. But right now, this coronavirus is going to hit its top peak this week. And what we're finding is that a lot of people have a lot to say about this coronavirus. And, whenever you get something like this going on, I remain calm. Let me tell you why I remain calm. Because there's only one way to look at this virus. All things come from the Most High. That's in Amos, the book of the prophet. Amos says, no evil can happen in a city, and the Lord have not done it. Once I understand that, I don't do anything else about that. And this is serious. Number one, some people say, is this serious? Is this real? This is not really happening here. Yes, thank you, Sister Linda. She's answering a question that I had. How you doing, Brother Roderick Whitaker? Thank you for coming in the chat room. Brother Dawi Ari bin Yisrael. How you doing, my brother? Thank you for being in the chat room with us as well. Ruth 116, thank you for being in the chat room with us. and all of that good stuff. So thank you all. Expected to peak in California on the 15th. Yes, and it's really peaking. But let me give you some more disturbing news about this corona. You cannot live in fear. Okay, that's number one. You can't live in fear. You have to look at everything comes from the Most High. Once you know that and you understand that God is in control of this world. That's number one. He's in control. I don't care what happens. God is always in control of the world. And it doesn't matter what man does or what man conspires to do, what man plots. God is always in control. And if anything happens, it's because the Lord allowed it. That's just simple as that. And that's how you have to look at this. Other than that, brothers and sisters, you're going to be in fear. You're going to be running around in fear. And, I've heard things that, coronavirus doesn't affect black people because we have melanin. And this is what was said when coronavirus first came out. And we have to be careful. We have to be careful. Let me just share this with you. Let me just share this video with you. Just check this out for a second.
There's this myth that black people or of African descent cannot get coronavirus. I have no idea where this notion originated from. There is nothing inherent about
I'm going to start it back over. Listen to this.
There's this myth that black people or people of African descent cannot get coronavirus. I have no idea where this notion is in city communities and more densely populated communities. Our children and our adults tend to have more frequent diagnoses of asthma and tend to do worse with these types of conditions. And then other things that we might do habitually. So are you a smoker? Are you a drinker? And then our communities tend to not have immediate access to healthcare. And then on top of that, sometimes we're dealing with healthcare disparities. So are we being taken seriously when we present for medical attention? Is always putting out information. The World Health Organization is putting out daily updates. You can tune into these very readily on their social media platforms. They have done a great job of communicating the information that we need to know in lay terms that people can understand, and they're giving a global report. And then you can tune into your city and state, either local health departments or governing bodies who are giving updates online as well. We have to tackle this thing from every point that we can possibly tackle it so that we diminish the spread in our...
Now that was from a doctor in Dr. Gaffney there. I believe that's what her name was. But I grabbed that because she is a doctor. She is an expert, and she was asked to do that interview. I was able to retrieve that interview, and I just want to deal with facts here. I want to deal with facts, okay? Because when you start to tell people that, if you have melanin in your skin, coronavirus doesn't affect you. These are the kind of things that I just said, I want to deal with some of this because this is what people are thinking. And it was just like in South Florida here, when the curfew and when the stay-at-home order came out here in South Florida and all the clubs shut down, there was a party. It was an outside party. Somebody found it underpass, a bridge, where there was a flat service road, and somebody thought, well, this would be a good place to have a party. So they brought a generator, and somebody brought lights, and then somebody brought their DJ equipment, and then somebody brought coolers and a grill. They say it must have been at least 2,000 people out there having a party. I mean, I don't understand where we do these things and think that it's okay, that it's not going to affect anything and nobody's going to catch this coronavirus, that there's a sense of immunity that exists with this. And this is not true. I just want to play this from the beginning again so we can get the doctor's name so you all can just see this just for a second.
There's this myth that Black people or people of African descent cannot
There
get
it is,
coronavirus.
Dr.
I have no idea
Alexia
where this
Gaffney
notion
Adams. I just wanted
originated from. There is
to
nothing
play that,
ignorant
just to
about
get
us
that.
as
Dr. Alexia Gaffney Adams. So she was asked to do that because, and I'm going to show you why she was asked to do that. She was asked to do that because there are some alarming information that's coming out of a lot of the major cities that is pertaining to this coronavirus. Now, as you know, a lot of African Americans make up only a short percentage, a small percentage of many populations and communities throughout the United States. But I just want to show you what's going on around the country so you can see the statistics of what's being reported when it comes to the coronavirus. Check this out here.
Late this afternoon, we learned 12,262 people in Illinois have tested positive for COVID-19. 33 more people have died since yesterday. We are now at 307 deaths. Within those numbers, a disturbing trend. People in the Black community are 7 times more likely to die from COVID-19 than other races. CBS 2's Chris Ty joins us from the lakefront with sweeping plans announced today. Chris.
Erica, first, why is this hitting the Black community so devastatingly? Well, experts say COVID-19 is particularly punishing against those who have high blood pressure or asthma, diabetes, or lung disease, often exacerbated by those who live inside food or medical deserts, those who live in unsafe neighborhoods with a heightened sense of stress, or tight living quarters.
Out of all of the disparities that are caused by the inequities in our society, healthcare might be the most inhumane. And I think this pandemic of 2020 magnifies that truth.
Of the 98 deaths related to this virus in Chicago, 72% are Black residents of the city. Consider Chicago is only 30% Black as of the last census. And of those Black residents who died, the vast majority had diabetes or heart disease.
Those numbers take your breath away.
In a press conference today with community leaders, Mayor Lightfoot announcing plans to create a racial equity rapid response team and new requirements for healthcare providers to provide deeper data sets on all patients to try and track vulnerable patients more thoroughly.
No one should have where they live determine how long they live.
COVID-19 exposing a decade, even centuries-like disparity between racial lines.
I think it's that big picture of what causes disparities, that it's not individual health behaviors or choices, that it's really these structural factors in society that go back to racist policies and discrimination.
Looking at Illinois as a whole, it's a state that's 14% Black, but Blacks make up 30% of all COVID-19 cases in Illinois and make up 41% of the state's COVID-19 deaths.
Today is a call to action. It is a call to signal that we are not going to tolerate these kind of disparities.
The mayor's racial equality task force will have a voice and a seat at the key table in the city. They will be there at the Emergency Operations Center as new crisis points come in, helping devise new strategy and plans as this troubling trend line continues to be monitored. Live on the South Side, Chris Ty, CBS 2 News.
Look at this chart. You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%. We want to bring in Dr. Frank McGeorge, and Frank, have said this all along. That's a significant difference.
Yeah, it sure is, and it's a.
I'm sorry. I realize you all did not hear me because I didn't have my microphone turned up. So basically, I'm just showing you. I'm showing you another clip. Thank you. I apologize for that, for the sound. So that was Chicago. I'm just showing you another video. I had cut down my sound so you can see it, but I know you got sound now. I just wanted to show you another clip of what's really happening. Check this out here.
Look at this chart. You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%. We want to bring in Dr. Frank McGeorge, and Frank, have said this all along. That's a significant difference.
Yeah, it sure is, and it's a trend being seen around the country as many states and regions are breaking down the numbers by race. No doubt, the COVID-19 pandemic has affected African Americans very differently than other races, and the reasons need to be investigated. Whether you're talking about Michigan, where 33% of cases but 40% of deaths have occurred in African Americans, or Illinois, where 29% of cases but 42% of deaths were in blacks, COVID-19 is causing a higher rate of deaths in African Americans. In Louisiana, 70% of people killed by COVID-19 are black, even though they only represent 32% of the state's population. Now, the reason for this needs more analysis, but we do know, overall, African Americans are more likely to suffer from high blood pressure and diabetes. Both are risk factors that have been identified in other countries for developing more severe disease in COVID-19. Now, many speculate that the COVID-19 pandemic is helping to uncover health disparities that have long existed in America. Another avenue being investigated is whether there could be genetic and physiologic factors that could make certain races more susceptible to SARS-CoV-2. Everything from different numbers and types of certain receptors to the way different races might respond to the massive inflammation induced as COVID-19 worsens are being looked at. Now, I realize it's really tempting to simply jump to the conclusion that the mortality differences that we're seeing in African Americans is simply due to healthcare disparities. But it is just as important to sort out any other potential contributing causes so we can figure out if there may be a more specific way to correct the problem. There's little doubt that underlying illness plays an important role here, but there may be much more beneath the surface. Back to you.
Yeah, okay. Frank, thanks.
You all can see what we're dealing with here. This is real. I apologize for the sound again. This is real. I mean, these are facts. This is, it's something that's actually, when we hear this and people say, oh, and this is why you got to watch what you watch on YouTube. Oh, it doesn't bother Black Americans because of the melanin in our skin. But you see what the numbers that are being reported. That's why I brought in the doctor who was a physician dealing with this, who they asked, let's do an awareness. Let's bring this stuff out. Now, some people are going to say, oh, it's a conspiracy theory. They're doing this to wipe us out. They're doing this to do that. Listen, let me tell you something. Let me just give you one scripture. Deuteronomy 28. That's it, people. You will be the number one in all diseases. And this COVID-19 is no exception. No exception. No exception. So when you look at this, some people might say, well, we can't believe the news media. Well, nobody else is an expert witness. So this is why I say it's just beware of what you come across. That's all. Just beware. Be mindful. Look, investigate. Are those new news media outlets telling the truth? Who knows? Who knows? But the fact of it is, statistics, and if there are people that I'm hearing in the black community that are dying. I mean, dying, like leaving this place, going quick. So when some people say, well, I can't believe the news, I want you to start asking some people around you and see what's really happening. Because I'm going to tell you something, this is real. This is no joke. It's happening. And then some people say, well, you know, we have melanin. Listen, until the Messiah comes and returns, you will be the number one in all diseases. There's no time frame on it. You're going to be the number one in all diseases, all pestilence, everything. Least of the population, but the number one. Because the curse is still on Israel. The curse is still there. So when we tell people, oh, it doesn't affect people of color, let me tell you something. It's affecting all people of color. And those statistics are very high. You have the mayor of Chicago. I want to go back and play that one. I want to go back and bring out the one that the mayor of Chicago brought out. If y'all don't mind, I just want to go back to that. I just want you to look at this, okay? Because I see some people just came into the chat room, and some people, you know, they still may be doubters, and I can't believe the news. But I mean, and then people say, well, you know, they paid them to say that. Listen, I'm tired of that buffoonery. We got people that are dying, and it's affecting us because we say it's not real. You know, you got people out there saying it's not real. Oh, this is not real. They lying to us. Let's just check this out one more time. Check this out. I'm sorry, I need to go back and find that. Give me just 1 second. Here we go.
Late this afternoon,
it's right
we
here.
learned
Listen to this.
12,262 people in Illinois have tested positive for COVID-19. 33 more people have died since yesterday. We are now at 307 deaths. Within those numbers, a disturbing trend. People in the black community are 7 times more likely to die from COVID-19 than other races. CBS 2's Chris Ty joins us from the lakefront with sweeping plans announced today. Chris.
Erica, first, why is this hitting the black community so devastatingly? Well, experts say COVID-19 is particularly punishing against those who have high blood pressure or asthma, diabetes, or lung disease, often exacerbated by those who live inside food or medical deserts, those who live in unsafe neighborhoods with a heightened sense of stress, or tight living quarters.
Out of all of the disparities that are caused by the inequities in our society, healthcare might be the most inhumane. And I think this pandemic of 2020 magnifies that truth.
Of the 98 deaths related to this virus in Chicago, 72% are black residents of the city. Consider Chicago is only 30% black as of the last census. And of those black residents who died, the vast majority had diabetes or heart disease.
Those numbers take your breath away.
In a press conference today with community leaders, Mayor Lightfoot announcing plans to create a racial equity rapid response team and new requirements for healthcare providers to provide deeper data sets on all patients to try and track vulnerable patients more thoroughly.
No one should have where they live determine how long they live.
COVID-19 exposing a decade, even centuries-like disparity between racial lines.
I think it's that big picture of what causes disparities, that it's not individual health behaviors or choices. That it's really.
I just wanted to just let y'all see that. I really did, because this is really starting to be alarmingly disturbing. And here's the other one. Here's another story I got to bring out. Everybody said, "Oh, it's the 5G." I don't know. But when you say things, you got to have facts. That's all I'm saying. So, fact or fiction? Which one is it? Is it fact or fiction? Here's what I do know based upon what I read. 5G is non-ionization. 4G, 3G, all of those are technology with ionization, and they cause cancer. Now, does that mean that 5G does not have any health implications? I don't know. Is it related to the coronavirus? Is 5G network causing the coronavirus? I doubt it, but I'm not a scientist. But I doubt it. I really doubt it. And so what I'm simply saying is, I believe somebody just put in the chat room, and I want to go back to what they said because it's so correct. Dawid says, whether we succumb to coronavirus or whether whatever's coming next, our best hedge is repenting, baptizing, keeping the laws and the statutes. Keeping the laws and statutes and commandments of the Most High. That's it, people. That's it. You can deal with this. You can get absorbed into this conspiracy theory and oh, it's 5G. Oh, they're taking us out. Oh, it doesn't affect us. Listen, I'm a numbers person. I go with facts. I go with numbers. I go exactly the way it is. Check out this one here. Check out this one here.
So this guy has more than 180,000 people who follow him. He just actually posted a video where he's drawing any potential coronavirus vaccine into other debunked theories about vaccines. Coronavirus equals planned depopulation is what another fan says. I mean, this could be really dangerous because if they do, hopefully, create a vaccine for coronavirus, which they're working on right now, this could just further push people away from doing something that could really help.
It's not just COVID-19, better known as the novel coronavirus, that's spreading fast. There's a flow of misinformation online about the virus, and health officials are mounting a concerted effort to combat it. They're calling it an infodemic. Social media is a major driver in the spread of falsehoods. The ease with which conspiracies are shared and reshared makes stopping something going viral online almost as difficult as stopping a biological viral outbreak in the real world. A 2018 study by Facebook found information, including misinformation, can spread like a virus. Each person passes it along to almost two others. Fake facts in the wake of an epidemic is nothing new. But after the deluge of misinformation around the measles outbreak that started in 2018, the World Health Organization is taking new approaches to tackle the problem.
Hey Andy, how are you?
I'm good, thanks. How are you doing?
I'm good. Would you call this the first social media epidemic?
I think there's probably been epidemics. We call them infodemics. And I think that this one could well be the first global one, yes.
So one of the big strains of the infodemic is misinformation about the virus's origins and how it's spread. Numerous sites and groups online have been falsely claiming that this virus is a result of some sort of biological warfare, some sort of bioweapon, or even created by the pharmaceutical industry to try to sell more vaccines. Now, this video on YouTube has more than 300,000 views. Now, this woman in this video is somehow connecting coronavirus and China with the new technology of 5G. She even uses code words, but it's not true. 5G has absolutely no connection to the coronavirus.
Another area of misinformation is fake cures and remedies. Some are harmless, like drinking garlic water or basic herbal tonics, but others are dangerous.
It's absolutely a fertile ground for anyone who wants to disrupt an already disruptive situation for natural reasons. In our social media monitoring, for instance, we've come across proposed cures and prevention options for coronavirus, for everything from you just need to pray to more harmful proposed treatments like drinking bleach.
Health officials are taking this infodemic seriously. The WHO is working directly with tech companies on a daily basis to flag and take down bad information, and to ensure that facts from reliable sources get to users first. Searching for coronavirus on sites like Twitter or Facebook pops up info boxes urging users to get the best information from reputable sources like government health organizations.
We're seeing different approaches from different companies. Some of them are taking a more aggressive approach to taking down this content. Are there some that you're more pleased with than others?
Yes, definitely. I think it depends on the company's maturity with regards to their social impact and their social care for their users. Obviously, how much they care about their reputation and their history of their reputation, of course. If they've suffered reputational knocks in the past, they're much more likely to respond now to help us.
We've contacted all the major platforms, and they've told us they're taking measures to combat this flow of misinformation. But these measures don't catch everything.
It's very difficult to just delete unless it's very clearly misinformation. And the tactics are not necessarily wrong. They are, in fact, provoking questioning and doubt, and you can't delete doubt.
In today's online world, there will always be misinformation. The challenge now for governments and platforms is how to fight a virus online.
Late this afternoon, we learned 12,000.
Now, I bring this out. I bring this out really because it's, like I said, it's just really getting to be sickening. Now, can you trust everything that the government puts out? No. Can you know that with the political structure that we're dealing with right now with the Democrats and the Republicans, you can't believe anything. But what I'm telling you in this title tonight, when we got coronavirus, fact or fiction, do your homework. Just do your homework. And you got to realize on the internet, people will put on there things like 5G causes coronavirus. People, they're going to get a lot of hits, draw a lot of people to the channel, and make a lot of money. So I can't believe them either. So the question is, who do you trust? You trust nobody. Trust in the Lord with all your heart. Lean not to your own understanding. In all your ways acknowledge Him. He'll direct your path. If you're keeping His law, statutes, and judgments, and you repented and you've applied the blood, guess what? You are protected, and you got to wake up every morning knowing that. You got to get up thinking that. You got to believe that. Does that mean that I go outside and I'm going to touch things and I'm looking for my hand wash? I'm not going to wash my hands. I'm going to go to the grocery store and I'm not going to put on a mask. No, I'm going to put on a mask. I'm going to put on some gloves. I'm going to get me some hand cleanser. I'm going to wash my hands. Does it mean I don't trust the Lord? No. Not at all. It simply means faith without works is dead. But brothers and sisters, do homework. Do homework before. It really alarmed me to see that you have, just in Chicago, 30% of the population in Chicago is black. 70% of the people dying of coronavirus is black. And that, brothers and sisters, is a perfect picture in all major cities. That's just the way it is. I believe it was in Detroit. I forgot what the percentage of the population, 14% of the population, but 42% of the deaths are African Americans, although they're 14% of the populations. This is what we're dealing with because people told people we have melanin, all this. Oh, it's 5G. Oh, it's this, it's that. Stop. This is what we have to do. I'm going to look into the chat room for a second before we go into our next part here. Rick says, 1 Peter 4:17, for the time has come that the judgment must begin at the house of God. And if it first begin at us, what shall the end be of them that obey not the gospel of the truth? Thank you, Brother Rick. Greetings, Sister Sarah Ben Yisrael. Thank you for being here. Franklin Grant says, JD Israel, I'm paying for the patience also. We've just got to trust the Lord and know that He's working for our good. Well, let me tell you whose good the Lord works for. If you are keeping His laws, statutes, and judgments, if you repented, if you're doing the best according to your understanding and seeking His truth, He's going to put a hedge around you. Does that mean that you're not going to catch the coronavirus? No. No, not at all. No, it doesn't mean that at all. No, nobody can guarantee that. Nobody can guarantee that. But what I can guarantee is what the Scripture says, that He will keep us, He will protect us, He will bring us out. I believe that. I believe that every day. I believe that. Tasha Kelly, how you doing? Glad to see you in here with us tonight. So this is what we're talking about. Now, this is what I want to do, because again, I'm a history guy. And some of you I'm older than most of you here in the chat room, and I'm a history guy. And I want to bring some things to your attention of what we need to do. The best way to look at the future is to look at the past, because the past has history that can tell you what's going to take place in the future. Now, as a consultant, which I really do because I went back to work, but as a consultant, when it comes to helping people how to determine what to do or how to handle things, I use a model called predictive, a predictive tool. And let me show you how that works. Let's take a large department store. A large department store has items in the store. Now, what they will do, let's use Walmart for example. Walmart will go back 5 years, and they would take the first quarter, January, February, and March, and they will say, what are the items that we mostly sold in the first quarter of the year? And what they will do is they'll look at that analysis, and then they say, wow, well, there's a trend, so let's pack more items because we ran out of stock. And had we had more of those items in stock based upon historical and sales or previous sales, we would have made more money. Let's take South Florida. During the months of April, May, June, a lot of people are going to buy beach equipment because it's time to go back to the beach. And the tourists are coming in town, and they're going to storm the stores, and they want certain chairs and umbrellas and all like that. And if the stores use the predictive tool, they'll know what to put there, when to put there, and they base everything off of those sales. I give you another one that we see naturally all the time. Birds fly south during the wintertime. Every winter, they're going to fly south. No matter where they are in the world, in the United States, the birds are going to fly south every year, same season, same time. And you know what's even ironic? If you notice birds, when they start to come south, they always gather on the same electric poles. There's always certain poles in certain areas of town. Those birds always congregate on those same electrical lines. Why? I don't know. But it's just what they do. And you can predict that it's going to happen the same time every year. Well, what I decided to do is I decided to look at, Sister Tasha says, yes, supply and demand. Yes. Somebody says, what are the numbers? What are the Chicago numbers, not percentage? Does anyone know? Well, I don't know what the numbers are. I do know that Chicago, out of all the deaths that are in Chicago, that all of the people that have died of coronavirus, 70% are African American. 70% of the people that have died of coronavirus are African American, and African Americans make up about 32% of the population in Chicago. This goes back to the same thing. The African Americans are 14% of the population. Okay? African American men make up about, if I'm not mistaken, about 6% of the population, but they're occupying nearly 55-60% of the jail population. You see what I'm saying? So those are disproportionate numbers that are worth looking at. It's just simple as that. Now, some people might say, well, why is death so high among African Americans? I tell you, the number one reason I'm going to put on there is this. I'm going to go straight to the Bible. Deuteronomy 28. That's the number one I'm going to give you. Number two, lack of health insurance. Think about it. You sitting in the emergency room. I want you to think about this. You're sitting in an emergency room and you have these individuals that come inside of the emergency room. Let's say you got 10 people that comes inside the emergency room and you got 5 ventilators, but yet 10 people need ventilators, but you only got 5. Let me tell you something, people. It's going to come down to dollars and cents. Who has insurance? That's what it's going to come down to. Who's got medical insurance? Who's going to pay for this $50,000 machine that's going to cost $15,000 to $20,000 a day? It's just that simple. It's just mathematically simple, okay? Faith and Hope says judgment begins with us. I agree. Let me just show you this one here. And I want you to be a little patient with me because I'm going to show you another video. I'm not going to show the video in its entirety, but I want to show you a video dealing with the 1918 Spanish flu pandemic. I want you to, because I want to deal with conspiracy theorists. I want to deal with conspiracy theorists to the point that I want you, this is what I've done. Now, is this pandemic a mirror of coronavirus? I'll let you be that. I'll let you make that choice. I just want to show you a little bit of it, but you make that choice. And I want you to listen to it carefully, and I just want you to watch it. And when they use the word Spanish flu, I want you to put in your mind coronavirus. And when they say the location of where it started, originated, I want you to think Wuhan, because we know that that's where the first cases derived from, Wuhan, China. So, but when you hear the Spanish flu, and they're going to give you a location of where they suspected that it came from, I'm not concerned about the geographical area where it came from. I'm not concerned about the type of pandemic. I just want you to look at the similarities, and I want you to just think for a second. So let's do this real quick. You all check this out, and I'm going to bring this out. Check this out right here.
An estimated 500 million people infected, between 50 and 100 million dead. A world torn apart by war and by a strange, deadly new disease. It swept across the world, leaving nowhere untouched. It was so deadly, rumors spread through the streets that the Black Death had returned. This was the Spanish flu of 1918, the deadliest pandemic of the 20th century. Epidemics have infected societies throughout history. Usually epidemics come and go, but some truly stand out for their viciousness. In recent history, there has been no pandemic more devastating than the flu of 1918, sometimes called the Spanish flu or swine flu. It killed about 675,000 in the United States alone. The outbreak came in the midst of World War I, and the flu would actually kill more troops than combat. The flu of 1918 was so deadly it killed more Americans than World War I, World War II, Vietnam, Korea, and the wars in Iraq and Afghanistan combined. Yet Spanish flu was horrifying for even more reasons. It was very contagious, and it killed extremely quickly, sometimes in as few as 12 hours. It killed people in the prime of their lives, with the most victims being young, healthy people aged 20 to 40. Additionally, it killed some of its victims in bizarre, brutal ways, completely unlike a typical flu virus. Some symptoms actually closely resemble the plagues, which killed millions in the Middle Ages. But scientists have analyzed the pathogen's genome and verified it was not Black Death, which killed millions in 1918. It was just the flu. This video will cover how the flu began and how it spread across the world, the bizarre symptoms that made it so deadly, and how the flu pushed society to the very brink of collapse. If the epidemic continues its mathematical rate of acceleration, civilization could easily disappear from the face of the earth within a few weeks. Victor Vaughan, Surgeon General of the Army, October 1918. No one can be absolutely sure where the pandemic originated, but there are several theories. In northern France, there was an outbreak of a flu-like disease at a British military base in 1917. The base was located in a swampy area with lots of waterfowl and pigs. New flu epidemics often arise when people have close contact with sick birds or pigs. There was a separate outbreak of respiratory disease among soldiers from Southeast Asia who fought in World War I from 1916 to 1918. Most flus start in Southeast Asia, and some historians argue the soldier may have brought a new virus to Europe. But historian John Barry makes the case in his fascinating book, The Great Influenza, that the flu may have originated on a farm in rural Kansas by jumping from infected pigs to humans. Indeed, the first officially recognized cases of the Spanish flu emerged at a military base in Kansas. The U.S. had just entered World War I, and training and industry had ramped up at a rapid pace as the war machine fired up. But in rural Haskell County, Kansas, a war of another type was quietly beginning. Haskell County was in the grip of a deadly outbreak of what seemed to be a mysterious new disease. People in the community, farmers mostly, may have caught the new disease when a pathogen from sick pigs jumped species and began infecting humans. The new virus, the swine flu, was shockingly contagious and extremely deadly. A local doctor was terrified by the death toll of the new virus and contacted the U.S. Public Health Service for advice. His concern was noted, but nothing else was done. After all, it was a tiny rural backwater. How could it spread far in such a sparsely populated area? Slowly the virus began to die down as it ran out of new people to infect. Perhaps it would have stopped there had the times been different, but 1918 was the perfect breeding ground for a worldwide pandemic. In early 1918, every military base was teeming with young men training for war. The military hurried to build new barracks, hospitals, training areas, and facilities to support the influx of hundreds of thousands of men. Some of these men were volunteers, and some had been drafted. The strange new disease was just dying down in Haskell County when a few young men left there, headed to Camp Funston, Kansas, for training. Camp Funston, located at modern-day Fort Riley, was already over capacity, with 56,000 young men training for war. There hadn't been time to build enough barracks for all of them. It was the coldest winter on record east of the Rockies, yet many men were sleeping in tents without any heat and only thin blankets. In an effort to keep them all warm, The commander ordered all the men to move into barracks, violating the health and safety rules that dictated how much space each soldier should have. Inside the barracks, men huddled around stoves trying to keep warm. The men from Haskell County must have crowded in close too, even as they began to cough and sneeze. That's all it took. In the overcrowded barracks, the flu spread rapidly. It only took 6 days for the outbreak to begin. The men from Haskell County arrived on February 28th. Less than 1 week later, men began flooding into sick call. Within just a few weeks, the flu swept across the base, sickening thousands and killing between 38 and 50. It was a high death rate for the flu, but it was nothing compared to what was coming next. The virus was about to mutate and become much, much worse. Flu viruses are constantly mutating, and sometimes there will be a really big shift, or a virus that usually affects only animals mutates so it can infect people too. When that happens, it can be very deadly. The flu comes in waves. That's why we have a flu season. Although it may seem like a bad flu is done, the flu can hide for a while, or go infect people in a different part of the world and then return even worse. In the case of the 1918 flu, 3 waves of flu devastated the world. The first wave wasn't too bad, but the second and third waves were extremely dangerous. The outbreak at Camp Funston came just at the end of the flu season in the United States, so the first wave infected a lot of people, but then faded away. The military wasn't worried. They were grappling with a far more deadly outbreak of measles at the time. The flu virus seemed to fade away, but really it just went abroad to take on a world at war. It stalked into camp when the day was damp and chilly and cold, with a hand that was clammy and bony and bold, and its breath was icy and moldy and dank, and it killed so speedy and gloatingly greedy that it took away men from each company rank. The flu, Private Josh Lee, 1919. Nearly all the ships carrying American troops to war arrived at the port in Brest, France. In April of 1918, just as the flu outbreak was dying down at Camp Funston, an epidemic began in Brest and slowly began spreading throughout northern France. Despite the illness spreading in the city, more and more troops poured in. Healthy men would land, become infected, and then ship out to new duty stations and to the front line, carrying the disease through every small town and hamlet through which the armies traveled. The flu tore across France and followed the front lines into Belgium and the Netherlands. It jumped across the lines of war and began infecting the German army, actually affecting the outcomes of battle since so many troops were too sick to fight. It jumped from the German army to the German people. By May it had reached Italy, where it crossed the Mediterranean and surged into North Africa. It also arrived in England by May, riding back on boats with troops heading home. Infection and death rates began to skyrocket in Spain and Portugal. The flu gained its name, the Spanish flu, from the early infection and high mortality rate in Spain, where reported 8 million died in May. Spain was neutral in World War I, and as a result, it was one of the only countries that was reporting the news without strict government censorship. Most countries didn't want to reveal to their enemies that they were battling an epidemic, and didn't want to affect their people's morale, so the governments pressured the media to hide and downplay the severity of the virus. However, in neutral Spain, the press was free to report the news accurately. Newspaper headlines in Spain screamed of an epidemic that was killing millions, while other countries only whispered of the flu. The world believed the flu was worse in Spain, when in actuality, Spain was the only one talking about it at first. The flu continued spreading beyond Western Europe. By July, it had jumped to Scandinavia and Greece. The same month, the flu crept its way into a tense Russia, where the Tsar and his family had just been executed, and the Bolsheviks were battling with other factions to see who would control the future of Russia. A boat filled with 6 sailors arrived in Mumbai, India at the end of May. First, a few dock workers reported sick. Then workers at the next docks became ill. And then men at the nearby warehouses got sick, and so on, into the city. Ships left those same infested docks and spread to other ports in Asia. Sick people boarded trains in Mumbai and spread the disease like wildfire along the railroad lines up into the subcontinent and continental Asia. The flu showed up in China around the same time, spreading inland from a dock in Shanghai. By June, it had arrived in Singapore, a world trade hub where the flu infected the dock workers and spread to the local population. From the bustling docks, sailors carried the flu south into Indonesia and north into Malaysia and Thailand, where it continued to spread. By July, it had reached sub-Saharan Africa, with infected sailors who arrived at the ports. It entered West Africa from ships arriving in Freetown, Sierra Leone. It infected Eastern Africa via the port in Mombasa, Kenya. Ships arriving into Cape Town set the virus loose in South Africa. From these ports, influenza ripped its way across the continent, devastating the population. By July, it had also reached Peru and begun spreading across South America. By August, it had returned to North America. By October, it had reached New Zealand and Japan. By November, a lethal outbreak was surging across Colombia, Argentina, Uruguay, and Chile. Despite quarantines on ships entering port, dock restrictions, and a concerted effort at containment, it finally spread into Australia by 1919. In less than a year, the deadly flu had surged around the world. The flu was able to spread so efficiently for many reasons, including the movement of vast companies of troops around the world, and the conditions those troops were living in. World War I was desperately brutal.
Now, I just wanted to bring a little bit of that out. That's all. And I want to tell you some things I took note of. I took note of that this epidemic started with something that this virus started with something that we cannot eat, according to Leviticus, the 11th chapter. Now, that's fact. Irregardless of what people say, conspiracy theory, this thing came from eating exotic animals in Wuhan, China. Irregardless of what people say. About 2 weeks ago, the government of China put a ban on eating all exotic animals, a multi-billion-dollar industry, because they know it's out. It's out. Eating bats, eating cheetahs, ostriches, python snakes. It just goes on. Exotic animals that you just are not supposed to eat. It's just that simple. So I see a similarity with this virus with 1918 with the swine flu. That's number one. Number two, ships, cruises, international travel. That's how it gets around, people. That's how it gets around. Let me just say this about 5G network. 5G network's been up in New York. They've been putting out 5G throughout the United States. This virus started when we knew it started in Wuhan, China, when they reported its first cases. They notified the World Health Organization, known as WHO, that's what WHO, World Health Organization, we got an issue. We need some help. We're going to have a lot of people dying. And they did. And it spread. And why did it spread? The same reason that we just heard in 1918. People mingling, going into large groups, getting on international flights, cruises. Do you see what's been happening with the cruises that wants to come in? Can we come in? One came from Holland. Hey, can we come in? Because ain't nobody else letting them come in. But the United States, right, wrong, indifferent, it doesn't matter. They came in. International travel. It is what it is, people. Did you see a flyer that they had on there that things are closed? And then they had that thing, although it said no church service on Sunday, no church services on Sunday. But this is not the first time that they're doing this. This has happened 100 years ago. Every 100 years, there's a pandemic. So that's number two I want you to look at. How it spread was through international travel. I want you to pick up something else the video brought out that nobody's talking about. It leaves and it comes back. It made its way around a second time. And it was worse than it was when it came back the second time than it was on the first time. I want you to pay attention to that because, see, I deal with facts. I don't deal with fiction. I don't deal with conspiracy theories. I deal with facts. And the facts are this virus has a historical, you can look in the past and determine what's going to happen in the future. This virus is going to repeat itself, and it's going to be worse the second time than it was the first time. That's facts. That's facts. There's no fiction with this. There's no nothing. And facts are, when you look at the statistics of who the coronavirus hit, it was devastating. And then there was one where the doctor talked about, they had on there, beware of the Spanish flu and tuberculosis. Let me tell you about that tuberculosis, because you see, my father was a little boy, and he told me about it. He told me he lost 4 siblings, a mother and a father, to tuberculosis. It wiped out more African Americans than it did any other group of people. The same thing that this coronavirus is doing. It took place the same time period. And let me tell you what my father told me. He said, back during the time of the tuberculosis, he says he remembers his father this way. He was, I don't think he was quite 10 years old, but he just recalls his father going to the hospital, and they call it the TB hospital. And he just didn't see his father anymore. Never saw him. I never met my grandfather. But my father, you know, when you're a little boy, you ask your daddy, tell me about your dad. Tell me about your father, Daddy. Because I never met my grandfather. And this is the story that he can tell me about his father. I don't know, son. I mean, my father was a musician, and he got sick, just like a lot of people did. And he went into quarantine. He went to the TB hospital. I said, the TB hospital? What kind of hospital is that? Well, it was an old school that it was so many people dying that they quarantined people that they made a hospital out of it. Does that sound familiar today? And they went there, and he says, only thing I can remember is on the weekends we would go up and you see a building that was way back about almost several blocks from the street. You couldn't go up in there because everybody was quarantined, and people, they would let you get so close, and they had windows, and people would look out the window, and you would try to get the news which window your parent or loved one was in, and they would wave out the window, and you would wave back, and everybody would just jump up and down. There he is, there he is. And as time went on, wasn't coming to the window no more. Weeks went by, didn't come to the window, but they would still go and look. And then they got word that his father died. No funeral. They cremated the body because they didn't want anybody to get contaminated. And then he tells me his mother caught it. And there was not a breadwinner. Most of the kids had to go out and work. So at the age of 12 years old, he was working on a truck transporting horses. His job was to walk the horses, feed the horses, and clean up after the horses. And they went back and forth from Kentucky to Florida. And he says he got a letter. He hadn't seen his mother, and he got a letter that his mother had tuberculosis. 6 months later, he got a letter that his mother died. He never had a chance to go to the funeral, never had a chance to say hello, never had a chance to say goodbye. I says, wow, Dad, what do you do? I mean, Dad, how do you handle that? He says, son, the only thing I can do is walk on the side of the barn, cry, wipe my tears, and I had to get back to work. Now, people, let me tell you something. That's sad. I was almost sorry I asked my father about his parents. He says his siblings, he remembers them being born. You played with them, you know. Some of them was older, some was a little bit younger, and all of a sudden, they had that cough. They had the cough and the fever, and right away they get them out of there because that tuberculosis was highly contagious. They got them out of there, and they went to the TB hospital, and they never returned. So I deal with facts. I don't deal with fiction. It went away, it came back. And it came back stronger until they came up with a cure, taking the tuberculosis shot. Then you got some people, don't take a vaccine. Take a vaccine. I don't know what to do. I don't have that information for you. I'm not a doctor. I'm not a scientist. Some people are pro-vaccine. Some people are anti-vaccine. I don't know what to tell you. The only thing I do know is to trust the Lord with all your heart. Lean not to your own understanding. In all your ways acknowledge Him. He will direct your paths. That's the only thing I know, people. That's the only thing I know. And I don't want to deal with, oh, it's 5G. Oh, we got melanin in our skin. Oh, this is a conspiracy theory. Oh, they're trying to wipe us out. Oh, they're trying to depopulate. Stop. It is what it is. It is what it is. And that's the only thing I can tell you. In this whole discussion tonight, that's all I can tell you, is to deal with facts, not fiction. Deal with the truth. Don't let anybody else bring anything else crazy to you. I'm going to go over into the chat room. And just see what you all say. Keith Pratt says, Deuteronomy 28:58 and verse 63, curses for disobedience. We have, oh wow, I think somebody's speaking Spanish, I don't know. So let's keep over here. Ricky says, family, when the plagues of Egypt started, there was a point when they affected Israel. But then in Exodus 9, verses 4 through 7, they only went on our enemies. So there is light we must endure. Faith and Hope says, yep, dealing with things not to be eaten. Yep. Keith Pratt said there's nothing new under the sun. It's not. That's why you got to look at the history. Look at what happened. You know, it's something I can tell you. Veronica Brown says, yes, trust in the Most High. That's it, people. Just trust in the Most High. Let me tell you what you need to do. You need to keep your vitamins up. You need to eat your fruits. You need to eat your vegetables. And you need to pray. And you need to meditate. And you need to not operate in fear. Fear drops your immune system. If you're operating in fear, it's because you're not right with God. Get right with God. Know who He is. Trust Him. Believe in His word. That's it. And that's what I leave for you. Some of you all just coming into the chat room, and you know what I'm going to do? Just because they're not that long, I just want to go back to what started this whole thing. I'm going to leave. I'm not yet. I just want to replay some of this stuff so that you can hear. This is a doctor in dealing with the COVID-19. And I deal with experts. I deal with people in the field. I deal with people who you can say, okay, they don't have a dog in the fight. Check this out. I'm just going to show, these things weren't that long. I'm just going to show them to you again.
There's this myth that Black people or people of African descent cannot get coronavirus. I have no idea where this notion originated from. There is nothing inherent about us as Black in city communities.
Okay, I just wanted to show that to you. I just want to show that to you before I show you the other one. It goes right back. It just goes right back. Many of you all know people that have coronavirus. Incidentally, let me just say this. I spoke with my teacher this week, in fact tonight, and he sounds so much better, Pastor Bowie, Israel of God. And I spoke to him tonight. A few weeks ago, he learned that he had the coronavirus. And let me tell you, I was very sad. I cried, but then I prayed. And I just said, no, this is not what we do. This is what we do. We pray. We trust God. This is a test. This is a test for a lot of people. Do we really trust the Lord? Do we really trust the Lord? And let me tell you, sounded good, man. He sounded good. He sounded good. Oh, Pastor Johnson, I'm doing a lot better. I'm coming through. Everything's going to be all right. Oh, it felt so good. Let me tell you something. Sister Linda, here in the chat room, she was here. She asked us to pray for her niece. In her 30s, up in New York, living by herself, she contracted the coronavirus. She was devastated. She was, and I know Sister Linda. She is a member of Bethel, right here in South Florida. And she said, Pastor, my niece got it. She's got all the symptoms. She went and she got tested, and she's positive. And let me tell you something. We went to praying. People. That's what we do. We went to praying. And that's what we had to do to make sure that she got through this. Brother Micaiah of Zion says, that false came from a so-called Asian doctor in Wuhan, although there was an African that contracted but recovered quickly according to reports. Well, again, people are saying that people of melon don't catch it. Let's listen to this report. And I just want to play this one more time. Check this out.
Late this afternoon, we learned 12,262 people in Illinois have tested positive for COVID-19. 33 more people have died since yesterday. We are now at 307 deaths. Within those numbers, a disturbing trend. People in the Black community are 7 times more likely to die from COVID-19 than other races. CBS 2's Chris Ty joins us from the lakefront with sweeping plans announced today. Chris.
Erica, first, why is this hitting the Black community so devastatingly? Well, experts say COVID-19 is particularly punishing against those who have high blood pressure or asthma, diabetes, or lung disease, often exacerbated by those who live inside food or medical deserts, those who live in unsafe neighborhoods with a heightened sense of stress, or tight living quarters.
Out of all of the disparities that are caused by the inequities in our society, healthcare might be the most inhumane. And I think this pandemic of 2020 magnifies that truth.
Of the 98 deaths related to this virus in Chicago, 72% are Black residents of the city. Consider Chicago is only 30% Black as of the last census. And of those Black residents who died, the vast majority had diabetes or heart disease.
Those numbers take your breath away.
In a press conference today with community leaders, Mayor Lightfoot announcing plans to create a racial equity rapid response team and new requirements for healthcare providers to provide deeper data sets on all patients to try and track vulnerable patients more thoroughly.
No one should have where they live determine how long they live.
COVID-19 exposing a decade, even centuries-like disparity between racial lines.
I think it's that big picture of what causes disparities, that it's not individual health behaviors or choices, that it's really these structural factors in society that go back to racist policies and discrimination.
Looking at Illinois.
I'm sorry, when they say racist policies, people know. People know. Let me tell you, you go in that hospital and don't have no insurance. And add that on whatever type of biases people may or may not have. You don't have any insurance and somebody else does, you ain't gonna make it. If you need that respirator, I can tell you that right now. If you're in dire need and that respirator is going to save your life and you don't have no insurance and somebody in the next bed to you has insurance, you're going to die. If they had to make a choice, the hospital, bar none, don't even fool yourself. Don't even fool. You can be in there first. You can be the first one sitting in there and you could be in there 2 days before the other person came inside there. And if you need that respirator and you don't have any insurance, and by the time that machine comes in, somebody else came in, they got insurance, who do we give it to? Insurance, no insurance. Eeny, meeny, miny, insurance, no insurance. Insurance, no insurance. Insurance gets it. Every time. Every time that's going to happen. So, somebody says, I thought the government was covering the cost for the COVID-19. I guess that's not true. Well, let's just say this. True or not true, here's the case. You've got, in Chicago, 30% of the people make up the population that are black. And when it comes to dying from COVID-19, out of 98 people that have died, 72% are black. So, listen, it's so bad that it became newsworthy. It's just that bad. In Detroit, it was the same way. In Alabama, the same way. Tennessee, the same way. It's the same way across the country. It's so bad that people are saying, well, wait a minute. Why is it that out of this COVID-19, when it comes to death, more people of color are dying than others? Why is that? And it's so bad that somebody got to say, wait a minute, time out. Let's see what's going on here. Is it because somebody is making decisions that are racially motivated? Could that be who knows? Fact or fiction? Is it because systemically those that get sick to have underlying conditions such as heart and diabetes, like they say, most of those that are dying that are African American have underlying diseases such as heart disease and diabetes? Could that really be the case? Who knows? Fact or fiction? I'm not a scientist. I'm only getting into the facts of this. Pray. I hope, listen, this video went an hour and a half tonight. This is just a whole bunch. You know what? A whole bunch of stuff goes through my mind. It really does. It really does. And listen, it's getting too late in the evening to be bickering with people about the 400-year anniversary and all like that. Listen, it's 2020 and things still ain't got no better. Yeah, listen, I deal with facts. I don't deal with fiction. I'm dealing with facts, not with fiction. I just hope in the season of Passover that we would apply the blood of the Lamb on the doorpost, because this pandemic, the timing of it is so closely related to understanding the story of what got the children of Israel out when the death angel came. It was the blood from the Lamb that caused that death angel to pass over them. Remember that, and also remember historically that pandemic viruses have a tendency to leave and come back for a second round. So when the government says in a few months or 5 months or 6 months, however it is, hey, it's gone. Beware for it to come back again. That's history. That's fact. That's not fiction. That's fact. That's fact, people. Don't let your guards down. Because I'm going to tell you what's going to happen. You know what Israel always does? Let me tell you what. Let's talk about Israel before I leave. Let's talk about Israel. I'm like you, Brother JD. I'm fired up now. Let's talk about Israel. You know what Israel has a history of doing in the scriptures? And this is what I'm telling you. I deal with fact, not fiction. And I look at history to predict as a predictive tool, as a predictive model of what's going to happen in this virus. Soon as this virus goes away, Israel is going to do what Israel has always done. Every time Israel gets in trouble, they start crying out to the Lord. Oh, Lord, we're sorry. Oh, Lord, protect us. Oh, Lord, keep us. And the Lord would have mercy. And you know what happens? As soon as the Lord gives a little breathing room, what does Israel do? Go back to acting a fool all over again. That's history. That's history. Don't you do that. No matter what color you are, creed, I'm not talking. This is not a message of division. What I'm simply saying is, those of you that are keeping the commandments of the Most High, and if you're not doing it, and you know you should be doing it, don't start crying out, and then as soon as the Lord give you a little breathing room, you go right back to doing what you were doing. Because that's what the children of Israel were good for. Look in the book of Judges. That's what they did. The Lord put them in bondage. He left 5 nations to put them in bondage. They turned around and did everything God said not to do. As soon as they get in bondage, 8 years they were in captivity. They started crying out, Lord, Lord, please send somebody. Help us, Lord. And he sent somebody. That person's name was Othniel. Sent them. He delivered them. And you know what Israel did? Went right back to clowning. Clowning again. Just doing everything they're big enough to do. I'm just telling you. Went right back to doing what they were big enough to do. Forgot all about who brought them out. And the Lord had to put them in captivity again. Over in the book of Judges, read it. Had to put them in captivity again. And you know what they did? They started crying out again. Lord, we're sorry. We're sorry. We're not going to do it no more. Please, we're so sorry. The Lord have mercy on them. Brought them out again. Brought them. Well, you know what Israel did? They went right back to the same stiff-necked, stubborn ways. And this is why the Lord put this final one on us. He put a final one on Israel. I mean, listen, ain't nobody going to redeem you from this until the Most High returns. When Jesus returns, that's when you're going to get your redemption. If you have keeping his commandments, laws, statutes, and judgments, dietary law, following after him, repenting, baptized, only then, when he returns, will you be redeemed. Other than that, you're going to be wiped out like everybody else. Just like everybody else. In fact, it's going to come upon you first, because over in Ezekiel, he says, let the judgment begin at the house of God. That's where it's going to begin at, people. Little story over in Ezekiel. Ezekiel saw these angels come, and one of them had a writer's inkhorn. And when the one with the writer's inkhorn, they looked down, and Israel was just acting a fool, clowning, just doing everything they're big enough to do. But there was a few that says, oh my God, look at our people. Lord, Lord, have mercy. Oh Lord, they turned it against your commandments. It was just a few of them that did that. A few. Just a few that did that. And so the Lord showed the prophet that there was one that had a writer's inkhorn. He says, I want you to go down and write in the foreheads of those that are looking and they're sighing. You know how you sigh like, oh my God. Right on their foreheads. Because those are the people that are keeping the faith, keeping the commandments. Those that are just looking shamefully at what their brothers and sisters are doing out there. Their fellow Hebrews. They can't believe it. They're leaving the Most High. Those go down and write in their foreheads. And then he told the other ones, the other angels, now I want you to go down, and everybody who don't have my name written in their foreheads, kill them. Kill children, kill older, kill rulers, kill everybody who you don't see my seal in their forehead. And then check this out. And he says, and begin at the house of God. People, as soon as this coronavirus is over, there's going to be some people who don't know history that I showed you dealing with 1918, that this thing's going to flip back around again. And you know what they're going to do? As soon as this coronavirus is over, it seems like things are over with, they're going to go right back to their devilish ways and going to forget about praying and fasting. Oh, you got prayer lines all over the place. And there are some good prayer lines, very good ones. In fact, there's one tomorrow morning at 8 o'clock. I'm sorry, 7 o'clock in the morning. 7 o'clock in the morning. Don't y'all forget that one. I left some information out. I can't find it, but there's another prayer line. Go back, and there's a prayer line tomorrow morning, I think. Let me see. I'll get the number for you all later. But don't forget, most of y'all have the prayer line. Go back and get that prayer line and show up tomorrow morning at 8 o'clock in the morning. But I just want to bring this back out. I want to bring this back out of what people are going to do. As soon as this coronavirus is over, they're going to go right back to what they were doing, not realizing it's going to come back a second time. And it's going to be more devastating. And who's the Lord going to protect? Those of us who continue to pray and fast and don't take the Lord's grace and mercy for granted. I'm telling you. Sister Maggie Smith said she got her alarm set. Thank you, Sister Maggie. Y'all be there tomorrow. All praises, Brother Mark. Meditate day and night. Absolutely. Sister Shonda Clark says yes. All right. Let's see. Sarah Ben Israel said, I said the same thing, Pastor. We must obey the Torah. The Bible is being foretold. Isn't that the truth, sister? Isn't that the truth? Man. Israel can be some rebellious people. I'm telling you, there can be some rebellious people. I knew we had a problem. I knew we had a problem when a man turned around and put a curfew, and it was Israel that went down there and found a bridge on a service road. They went underneath the bridge. It's one of those wide bridges where they got like 5 lanes of it's like 6 lanes of expressway on each side, in each bound. So that means that was almost like 12 lanes of cover. And they found a way to have a party. I'm just telling you what we're dealing with. This is just what It's just what we're dealing with. If anybody has that phone number, I know it's 508, I don't want to guess at it, 294, I believe, 2928. But let me know. Let me know if that's what it is. Full-blown revelations, absolutely. Listen, this is just something. You all put that alarm. If you got that phone number, somebody put it in the chat room so I can put it up on the screen. I don't know if Sister Nancy or Sister Anita is in the chat room. I think they were earlier, but I need that phone number before we get out of here. I want to put that phone number in the chat room so that we can have it. I think it's 508-294. You know what? All I got to do is go to my phone. Oh, my battery on my phone went dead. Wow. Can't even do that. Somebody get that phone number for me. I think it's 508-294-2928. But it's going to be tomorrow morning at 7 o'clock a.m. If you have that number, let me have it, okay? How you doing, Brother Brian? Hope everything's well with you, brother. Yeah, I'm telling you, people are going to go right back to what they were doing. And the Almighty's not going to be pleased. There's going to be a lot of people taken out. A lot of people taken out. Pray us singles for marriage mates, Most High willing. Yes. Well, let me tell you something, sister. We're gonna pray. It's gonna take some prayer for that one. Let me tell you something. Let me tell you why. It's like 7-1. But God is able. He can put a testimony on your lips. That's what I believe. Brother Philip gave me the phone number. It's 508-924. There's the phone number. 508-924-2928. I had a little dyslexia there. I said 294. But it's 508-924. I was right on the 508 and the 2928. That's not bad for somebody who just had a birthday. Getting a bit older here, right? Not so bad. Brother Brian said, yep, this is a test too. Yeah, it is. It's a test. It's a test. It's a test to see who's going to pray. And then as soon as it goes away, you're going to go back to acting just like Hebrews. And then you got to cry out again. This is. I don't know what to say. I really don't. Other than tomorrow, let's say what's going to happen. Tomorrow is the Feast of Unleavened Bread on the 8th. On tomorrow, the Feast of Unleavened Bread, which starts tonight. It's already started. I'm going to be doing a lesson tomorrow. Tune in tomorrow. I don't know what time that lesson is going to be. I really don't know. But it's going to be tomorrow. Tune in. Brother Keith Press, I'm a truck driver, and in the trenches, I'm seeing it all, but I fear nothing. Absolutely, Brother Keith. Absolutely. Stay in the Most High, brother. Stay in the Most High. That's all you got to do. Heavenly Father, we thank you tonight. We thank you for helping and bringing Sister Linda's niece around. Thank you for bringing Pastor Bowie around. If there be any others, we know and have heard of so many that have lost their lives. We know statistically the signs are not good once again, but we're not surprised, Father. But we just ask that your people, your sincere people, your sincere Israel, natural, spiritual, adopted, and grafted, that they will stay fervent on their knees, stay perpetually to your name forever, not wavering at all. So we ask you, God, that you would just teach us to trust you with all of our heart, lean not to our own understanding, but in all of our ways acknowledge you, because you will direct our paths. These are the things we ask you for, dear God. In Jesus' name we pray, amen. Let me just say this, people. Let me just say this to you. Stay real. Stay real. Whatever you do, stay real with this. And I can tell you, everything will be all right if we just stay real with this thing. Now, I'm going to leave this with you. I don't know, let me see, I'm going to leave out. Y'all know I always leave some good songs with you. Don't forget this. I want you to check out this commercial real quick. If y'all haven't done it, check it out. Don't go anywhere. I'm coming right back. All right, don't y'all forget that phone app. You can go to the Play Store, you can go to the Google Play Store, the Apple Play Store. Get that phone app. That phone app has been rated 5-star. Thank all of you all that have downloaded that app. If the Almighty places upon your heart, don't forget our Cash App. I'm going to put our Cash App up here. So as a ministry, we can continue to push this word. I like Cash App because our treasurer told me that it goes directly to the account and a lot quicker. The phone app does work, but if you do go and download the phone app, and if you go to the donate button, when you start to fill out the registration, please type your email all the way out. Do not use autofill, because autofill unknowingly puts a space behind, like if you're using .com or .net, it'll put a space after that last character, and it reads the space as a character, and it's going to say invalid email. It does the same thing with your password when you do autofill. So just keep that in mind when you do that. So Kenneth says, from an old trumpet player, I love the video and music. Thank you, Brother Kenneth. So yeah, that's just a little promo. I keep calling it a commercial. By the way, let me say this. Thank you all for those that are a part of our Patreon. We have a new format, so as you know, I'm able to do a whole lot more with this. And I want to thank you all that do that and do support us in this, because we're going to make sure we continue to get this ministry out. Thank you very much, Ruth 116, who has downloaded the app. Sister Veronica, my sister, thank you so much, very much. And don't you worry. I'm going to pray for that. You know what I'm talking about. So all of that being said, I'm going to leave this with you all. Look for us tomorrow. We'll be bringing that lesson to you. Peace.
You unravel me with a melody. You surround me with a song of deliverance from my enemies, till all my fears are gone. I'm no longer
From my mother's womb, you have chosen me. Love has called my name. I've been born again to a family. The blood flows through my veins. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. No, I am a child of Let's declare to the nation. You set us free from the enemy. You set us free from the enemy. Yes, we are free. 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 We are You split the sea so I could walk right through it. You drowned my fears in perfect love. You rescued me so I could stand and sing. I am a child of God. You split the sea so I could walk right through it. You drowned my fears in perfect love. You rescued me so I could stand and say, I am a child of God. You split the sea so I could walk right through it. You drowned my fears in perfect love. You rescued me so I could stand and say, I am a child of God. I am a child of God. I am a child of God. Yes, I am a child of God. Yes, I am a child of God.
You unravel me with a melody. You surround me with a song.
Most High, He's calling out to the nations. Peace. Be still. Judah, Gad, Benjamin, Manasseh, Asher, Naphtali, Zebulun, Issachar.
I'm speaking peace over your situation right now.
Dan, Simeon, Ephraim, Reuben. Sea is tossing, evil roaring, waves clashing, times passing, people are lashing. Hear the cries of souls in distress. trickle of injustice far, it won't rest. You gotta remember, days of old love takes control from evil strongholds. Beast in the sea, birth from racism. Devil don't care about us. Dragon breathe the fire of hateism. Lost souls in the maze of darkness. Evil taking control of the heartless. We must not get distracted from the divine revelation. The teacher generation, to build a holy nation. We are children of the Most High, holy God's precious creation. Most High is calling out to the nation. Say peace, be still. Out of the sea, evil nations powered by the dragon, speaking blasphemy against the God of peace, destined to make war. The sea is in a rage, beast roar, release the terrorism from its iron cage. The trail of tears, simulation, souls trapped, named, deleted, enslaved for years. CER in accelerator, man's quest to be the creator. The sea is unrest, colors flashing, flags flying. It's very clear to me why the souls are crying. Virus into the system, these directories. The root bears evil fruit. Those who have fears, let them hear what the Spirit say. Endure, overcome, I will give you peace that's everlasting. Say peace, be still. Peace, be still. Peace, be still. Revelations 21, the word of the Most High reads, says, Then I saw a new heaven and a new earth, for the old heaven and the old earth had disappeared, and the sea was also gone. And I saw the holy city, the new Jerusalem, coming down from the Most High out of heaven like a bride beautifully dressed for her husband. Glory to the Most High. I heard a loud shout from the throne, say, Higher! Glory, glory, glory. Look, the Most High's home is now among his people. He will live with them, and they will be his people. The Most High himself will be with them. He will wipe away every tear from their eyes, and there will be no more death or sorrow or crying or pain. All these are gone forever. Peace, be still.